Now, the COVID-19 pandemic is having far-reaching consequences on human lives. The physical impact of the virus is well known by now. People have lost a lot to this crisis. Some have lost their loved ones even, while others have lost their livelihoods. The pandemic has brought severe human suffering along with it. The United Nations has now warned that a major mental health crisis is looming large due to this pandemic. UN Secretary General Antonio Guterres, in a video message, said that the COVID-19 pandemic was not only attacking one's physical health, but also increasing the psychological suffering. He said that the crisis could spark mental health problems, including depression and anxiety. Guterres warned that the pandemic was hitting families and entire communities with additional mental stress. Healthcare and other frontline workers, Guterres said, were under tremendous stress and stood at the highest risk. The United Nations has launched a new policy brief entitled COVID-19 and the Need for Action on Mental Health to Deal with the Crisis. In his message, Guterres also called for governments across the world to support those in need of mental assistance.
Is at the core of our humanity. It enables us to lead rich and fulfilling lives and to participate in our communities. But the COVID-19 virus is not only attacking our physical health, it is also increasing psychological suffering. Grief at the loss of loved ones, shock at the loss of jobs, isolation and restrictions on movement, difficult family dynamics, uncertainty and fear for the future. Mental health problems, including depression and anxiety, are some of the greatest causes of misery in our world.
A report presented by the World Health Organization's Mental Health Department has also warned of a mental health crisis. The report has highlighted several regions and sections of society as vulnerable to mental distress. This included children who were kept out of school for a long time and women who faced a heightened risk of domestic abuse. Several national studies have also indicated that mental stress is mounting rapidly. One study conducted in Amhara region of Ethiopia showed that 33% of the population was suffering from depression-like symptoms, a threefold increase from the levels before the pandemic struck. Other studies have indicated that at least 45% Americans were also showing prevalent mental distress symptoms amid the crisis.